Good afternoon, and my name is Dani and welcome to my presentation on a comparison of post-mortem computed tomography and external examination of the neck in suspected hanging cases. I would like to address the nature of some images may be distressing, and therefore would like to provide a disclaimer for starting this presentation. From this study, indicators such as mental health, illicit and prescription drug abuse, cerebral ischemia, and neurodegenerative disease identified minimal to no new findings in comparison to the current literature. And therefore, for the purpose of this presentation today, I will present the new findings of this research on the following indicators. The first being the presence of a ligature mark. The key findings from the research conducted in accordance to this indicator was the failure to submit or find a ligature with the patient at the scene, and therefore this can be illustrated in cases N and J. This is significant and a vital finding to aid the classification of the cause and manner of death, which can be identified through the positioning of the ligature mark and the type and knot. I would suggest where the ligature is not found with the body, a search of the premises should be conducted or the surrounding area in order to increase the chances of finding that ligature, and therefore for the highest amount of evidence which can be obtained in order to assist the pathologist at the mortuary. Soft tissue injury in case B suggested the presence of a periligatural mark, which is fingernail marks surrounding the ligature itself, which is where the pathologist recorded a contributory factor to the classification of suicidal hanging in the post-mortem report. The ability to determine the nature of the soft tissue injury is difficult, as it can be classified as either self-defense or regret. 100% of cases at external examination within this study were reported to have soft tissue injury, highlighting the benefit of conventional postmortem technologies when used in unification with postmortem CT. Laryngeal and hyoid fracture is suggested as an uncommon trauma from suicidal hanging by literature. This is highly juxtaposed in the research obtained, as can be seen in this study, where the fracture of the hyoid and laryngeal structures was observed to be very high. In fact, it was 37.57% of all cases. Critically, cricoid fracture is deemed as a homicidal hanging indicator as opposed to a suicidal hanging indicator. However, 10.52% of cases in this study observed that fracture type, boding the question of whether it should be considered an indicator of fracture of hanging when a fracture is observed generally as opposed to specifically homicidal hanging. Postmortem CT is a critical tool which enables the identification of these indicators, addressing the invasive nature of conventional postmortem methods. Therefore, PMCT is a critical tool to facilitate the classification of cause of death in suspected suicidal hanging cases. This also relates to the case with regards to the identification of other pathology, as its assistance with the type of autopsy required, if any, highlighting the essential working of pathologists and radiologists in unison, as well as the methods themselves. Asphyxiation and hanging as the classification of cause of death differed significantly from digital autopsy to postmortem reports. I would therefore recommend that pathologists and radiologists communicate their reasonings for the causes of death, and in order to identify succinct classification to be concluded, ensuring the documentation is uniform. This leads on to the point where the documentation of the postmortem reports and the inclusion of the digital autopsy reports did not conform to all best practice guidelines and standards of practice outlined by the Royal College of Pathology. From feedback from postmortem consultant radiologists and pathologists themselves, it was suggested that a template would enhance the uniformity and the regulation of the data, as can be seen by a prototype that I have created here. This is evidenced by the disparities between the reporting of above and below the laryngeal prominence in postmortem reports, as well as the inclusion of a summary from radiologists. This template identifies these issues which I have observed and puts forward a regulated way in order for the data to be collected comparably and in uniformity. A considerable literacy finding was the use of gas bubble sign as a diagnostic indicator of a fractured hyoid in a hanging case. In this study, gas bubble signs were not presented in any of the cases where a hyoid fracture was seen, boding the question of what it is, how long they last, and if they are seen to move or increase and decrease in size. Conversations with radiologists suggested a ruptured pharynx could be the answer for the presence of gas bubbles. From this, further research would facilitate a deeper understanding of gas bubble sign, as well as conducting a series where the movement and size of gas bubbles could be monitored over a duration of time in order to further understand and quantify the significance of them as an indicator of fracture in hanging cases through the use of PMCT. Petechial hemorrhage was most commonly found in cases where the BMI of the deceased was severely obese and the ligature mark was above the laryngeal prominence. One of the pathologists in the case specifically concluded petechial hemorrhage is a sign of asphyxiation. However, literature suggests alone the indicator does not quantify the classification of asphyxiation. Images from the first attending officer of the conjunctival petechiae, if present, could facilitate the accuracy of the determination of petechiae and help it being used as an indicator for asphyxiation. No movement of the deceased prior to scanning or the external examination at the mortuary would diminish the possibility of petechiae as a result of positional asphyxiation. Overall, PMCT is an invaluable technique to assist the external examination of the neck in suspected hanging cases, specifically suicidal, as it provides further details without the need of invasive procedures. I would therefore recommend the use of PMCT in conjunction with the use of conventional methods as a form of good practice guidelines. Thank you for listening.